Hello everyone, I'm 𝗤𝗂𝗃𝗧 Caroline and today I'm here with Tina. We are from 𝗖𝗺. So we are back with another role play where we are going to discuss a case scenario where a patient is approaching you with a burn. So he was ironing the clothes and accidentally he dropped the iron on his foot and he's worried about a scar. So Tina will play the role of the patient and I will handle the part of the nurse. So let's do it.
Let's get started.
All right.
Okay, so this is your cue card and you get 3 minutes to prepare and your time starts now.
All right, thank you. Good morning.
Good morning.
So, Mr. David, thank you so much for your patience. I just examined your wound and I can confirm you that it's just a superficial burn and I can also see the presence of some blisters and few white patches. I know it comes as a shock for you, but there is nothing to be worried about. As I mentioned, it's just a superficial burn, okay? So, do you have any concerns about it?
Yes, nurse, I have a lot of concerns about it. Initially, when I was ironing my clothes, when the iron box fell over my foot, I thought my foot is completely damaged. But now, as you said, it is just a superficial burns. I don't understand what that superficial burns mean because I am a coach and I have to coach students because I'm having a camp that is going to come next week and I really don't know how I am going to go forward with that. I'm completely stressed out and I am very much worried about my leg. Could you please tell me in detail what is all this about?
Absolutely. I do understand that being a coach, you might have a lot of commitments and having a burn on your foot might be troubling for you. But don't worry about it. As I mentioned, it's just on the outer skin of yours, so it can be totally managed with few medication. But before we get into further details, I need to ask you some questions so that I can understand what exactly we have to do for you, okay? So could you tell me whether you have done any first aid method at home?
I don't know whether what I did was right, but I'll tell you what I did. Okay, so when the iron box fell over my foot, it got burned and I was having severe pain. I rushed to the bathroom and I poured water over my legs. After that, I applied some ointment. I don't know the name of it, but I saw my wife keeping it near to the, near to the kitchen. So I applied it over there. So, but I think there's a scar and it is a lot of blister is there and my skin is all gluey. So I don't know what it is, but I'm totally worried about it.
Okay, I appreciate your concern. So is the first time you're having a burn?
Yes.
Oh, right, okay. And you told me that you applied an ointment and you don't know the name of it, right?
I don't know.
So do you feel any discomfort after the application?
Oh yes, nurse, it's still burning. I feel like putting my leg into one big bucket full of ice. Like that it is burning for me. Could you please do something over that?
You should definitely, we'll look into it, okay? And did you take any pain medication like any tablets or anything like that?
No, nurse, I didn't because I don't know what medicine to take, so I didn't take any medicines.
Oh, right, okay, don't worry about it. So I'll explain what we are going to do from our end, okay? So now the doctor will be here soon because he needs to administer the burn and make sure that there is nothing complicated, okay? And we will dress the burn for you. I will clean it for you right now. But before that, I need to check with you. Do you feel any sort of discomfort? Like, do you feel nauseous or dizzy, or even do you feel like a rise in temperature?
Rise in temperature, I don't know whether it's because of this burning sensation that I'm having a rise of temperature. Yes, I do have that. And I think even with the rise of temperature, I'm again sweating also. And then I'm having a headache because of the severe burns that I've got into my leg. I think maybe because of the stress and the upcoming, the camp that I have to, so all these things is making me a little more worried about it. I think these might be the reason, I guess. I don't know.
I understand. Right now you're really stressed and you're worrying so much about the upcoming match and everything. I know. Please be calm. We will be doing everything from our end for you, okay? So right now I told you that you're having the presence of some blisters. So I'll explain what we can do about the blisters for you, okay?
Nurse, please tell me.
So it is very important to leave the blisters alone because seeing the bubbles, we will have the tendency to pop it, but please make sure that you don't do it because it can lead into infection and some other complication, okay? And in case of severity, we can even aspirate the fluid or remove the top layer of the skin. Again, as I mentioned, the doctor will be here anytime soon and based on his advice, we can take it from there, okay? Because he's the right person to address all your concerns and see whether there are any complications or not. So he can give you the correct advice. So he'll be here anytime soon. All right? And do you have any questions?
Yes, nurse. One more question. Will I have any scarring?
That's a very reasonable concern, and it is normal to have a scar after a burn, but in your case it is a superficial burn and it will heal within 14 days of time, approximately 14 days.
Yes, 14 days.
Yeah, approximately 14 days because the burn really needs to get completely healed. And you know, there will be a little bit of scarring, but again you do not need to worry too much about it. But at the moment what we have to consider is the healing phase. First we need to heal it and then we can worry about the scar, but as a whole there will not be a very big complicated scar. We can take care of it. Okay? And we will consider you as a priority case. As I mentioned, the doctor will be here anytime soon. He will address all your concerns. Okay,
fine.
So do you have any issues in waiting to see the doctor?
No, I don't. I just want my, my foot to get healed fast as possible. That's all.
Absolutely, we'll do everything from our end. Okay, so I hope I have clarified everything for you. Do you have anything to ask me?
No, nothing more, nurse. You have been very helpful and thank you so much.
No problem. So please wait here. The doctor will be here anytime soon. Okay.
Okay.
Thank you very much.
Thank you so much. Okay, so well, we have come to the end of our role play. First and foremost, Richa, the role play was very good. Okay,
Right.
So this is a different task. That is, we have seen many cases where a patient gets burned.
Yeah.
But this is a different setting or a different situation where the person's foot is getting injured by an iron box, and he's a coach.
Yeah.
He's worried what will happen to his legs because legs are very important, right?
Exactly.
Yes.
So in this case, we just do not, it's not just about the medical scenario. We need to emotionally support this patient too, because he's worried about his career here too. So we need to address that concern along with the medical case. So these are the different techniques how we can emotionally support the patient by doing the task. Okay.
And I think when it comes to emotional support, I think you're going to give a good feedback on those,
Absolutely.
right? How to frame sentences and how to help the patient out emotionally.
Yes.
So we'll see what Richa has to tell us regarding the feedback.
Okay, so stay tuned. We'll be getting into the feedback form.
Okay then.
Hello everyone. So just now we saw a video where a patient has approached the nurse saying that he accidentally dropped an iron box on his foot and he's really scared about getting a scar, and we saw how the nurse actually tackled the situation. So now let's see how we can pick the keywords and create sentences for the tasks. So let's get started. So let's look into the task number 1. Confirm the presence of blisters and few white patches. In brackets it's given superficial burn. Explore whether any first aid methods adopted. Pain relief, cleanse the burn area. So here we can see the first task starts with the word confirm, and also in the description box it is mentioned that it is a non-case because the examination was already done. So you can start the role play by confirming the diagnosis. And also the first task has got 2 sessions. After the confirmation of the diagnosis, you have to ask whether he adopted any first aid measures. So let's figure out the keywords here. So the first keyword would be presence of blisters, few white patches, superficial burn. In the second half, it would be first aid methods adopted. So let's figure out how we can create a sentence using these keywords. The sentence can be, Mr. David, thank you so much for your patience. Based on my examination, I can confirm that it is a superficial burn with the presence of blisters and few white patches. That is the first half of the task number 1. Now, if you look into the second half, we have to ask a question about what are the first aid methods he adopted. So you can move into that by saying, before proceeding further, I would like to ask you whether you have adopted any first aid measures. Like, did you take any pain relief medication, or did you clean the burnt area? So this is how you can incorporate the keywords in task number 1 to create a sentence. Now let's look into task number 2. Explain the next steps administered by the doctor, dress the burn, check whether the patient has any discomfort, nausea, fever, dizziness. So like in case of task number 1, here also you have got 2 sessions for task number 2. So let's figure out what are the keywords. In the first half, we have to mention about the next steps. So obviously, the keyword here would be next step. And then we have to mention about what are the steps we are going to do, which is mentioned in the bracket. And second half of the task number 2, we have to figure out the keyword, and which will be discomfort, because we are trying to figure out what are the discomfort the patient is feeling. So let's create the sentence here. Don't worry, Mr. David. I'll explain what we are going to do next. The doctor will be here soon and he will administer all your concerns. Also, we will dress your burn for you. Then we are stopping there. We are interacting with the patient for a while and moving on to the next session of task number 2. You can say, before we proceed any further, I would also like to check whether you are experiencing any discomfort. Do you feel nauseous? Do you feel feverish? And do you feel dizzy? This is how you can do task number 2. Let's look into task number 3. Explain the treatment for blistering, leave alone, aspiration of fluid, removal of top layer of the skin. It's very simple. So here the keyword would be treatment for blistering. So you just need to briefly mention about what we are going to do for the blister treatment. So the sentence can be, I can sense you're really worried about your condition, but don't worry, I can provide you details about the treatment we can do for the blisters you have. This is just an elaborated one. You can create a simple sentence as well. So now, once you gave an intro about task number 3, the points that you have to mention in it is, please make sure that you leave the blisters alone. In case of severity, we can even aspirate the fluid or remove the top layer of your skin. As I mentioned earlier, the doctor will be here soon and he will provide you more information about what we can do about it. So that's how you can conclude task number 3. We have one more task. Let's look into it. Advice on possibility of scarring. Superficial burns usually take up to 14 days to heal. Minimal scarring. Again, it says, reassure patient about the next steps. Priority case, pain relief will be administered, doctor to address concerns. Again, establish patient's willingness to meet the doctor. So we have 3 segments here. Let's figure out the keywords. In the first segment, it is possibility of scarring. And additional details are mentioned in the bracket, so you have to mention those points. In the second segment, the keyword would be next step. What are the next steps? It is mentioned in the cue card. In the third segment, willingness. So these are the 3 keywords you have to incorporate in this particular task. So let's see how we can create the sentence here. Mr. David, I understand that you are having a lot of worries about the possibility of scarring. But let me just tell you, it is just a superficial burn and usually it only takes up to 14 days for the superficial burns to heal. And the possibility of a scar is minimal. So this is the first segment. Moving on to the second segment, you can say, I understand you are having a difficult time, but I reassure you that you will be considered as a priority case. The doctor will be here soon and he will administer a pain relief medication for you. And he will address all your concerns. Segment number 2 is done. Then moving on to the third segment, you can say, so I hope I have clarified all your doubts. Please wait here to see the doctor. Or you can take a permission. Is it okay for you to wait here to see a doctor? So in case if you have any queries, do not hesitate to drop it in our comment section and we'll definitely get into it. So thank you so much for watching. Keep supporting us.
𝗖𝗂𝗚𝗏, it's my cup of tea.